Had the forecast been accurate, we probably would have had to work yesterday.
The best
you know what
snow
I mean?
day ever.
Right,
Thank you,
Jen?
Sue.
Yes, I was happy to be sledding. Hey, check this out. This is the item that many plastic surgeons and many women and men all around the Delaware Valley want. It's brand new. It's called Voluma. I'm going to tell you what this will do. Life-changing is what they're saying, Sue.
Well, maybe not life-changing in the forecast, but...
So here's what we were talking about our beauty products that I'm buying. I'm sort of quite fascinated by all of the beauty products and the fillers and things.
Well, forget about Botox, Karen. There's something new and maybe better than Botox.
Hey, guys. Okay, so Botox is the #1 procedure in the world right now. We're here with Dr. Jason Bloom. Good morning to you.
Good morning, Jen.
But a lot of people are talking about this. I want to be candid. I've had plastic surgeons who are like, have you heard of Voluma? Voluma? Have you heard of Voluma? No one could get their hands on this for quite some time. Why is this such a hot product?
It's a hot product for a number of reasons. Well, it was just actually launched commercially in the U.S. last Monday. I've been injecting it for a couple weeks now, and very excited about it for a few reasons.
Okay, so I want people to see this picture. So this is obviously Us Weekly. This is Lauren Conrad. You look at her cheeks. She has blush on, and as a 75-year-old that I am, I look at her cheeks and I'm like, they're so up, they're high, and they're full. And that's sort of what people are trying to get.
Right. People want high cheekbones, a little bit more of the, what we call the mid-face volume in this area.
Okay.
So this is a really groundbreaking filler for two reasons. Number one, it's the first filler ever that has been approved by the FDA for age-related volume loss in the mid-face and cheek area, whereas all the previous fillers out there have been approved for this, which is the parentheses or the nasolabial fold area.
Okay.
The second area, the reason that this has been so exciting is that it is really long-lasting. So previous fillers, you're looking at anywhere from 6 months to a year. The FDA actually approved this for 24, 25 months, and they stopped the study because over 80 to 90% of the patients were still happy with their treatments at 2 years.
Okay, this young, gorgeous person is sitting here because you are going to inject her, and we're going to see the results in the 8 o'clock hour. You say
exactly.
That's how quick women can see this thing.
Yeah, the results are almost immediate. You'll be able to see a little bit, and then there is a little bit of swelling over the next 4 to 5 days. Where they'll even look a little bit better, but you'll see almost an immediate difference, and we're going to kind of volumize this cheek area and just bring this up a little bit. Done in moderation, this looks really, really
She's
good.
not going to look like, forgive me, Madonna when she had the big, it looked like she had baseballs in her cheeks.
No, absolutely not.
I love Madonna.
We're just going to give her a little bit more volume and just kind of raise up this area. She has a little bit of volume loss in this area, so I kind of show patients like this.
Okay. By
raising this up a little bit, giving them a little bit extra cheek volume, it'll be great.
Do you think this is going to be the new Botox, that it'll be as popular as that procedure?
Well, fillers are already very popular. There's over 6 million Botox procedures in the United States every year. Fillers being number 2 as the most common cosmetic procedure. This is nice because you don't have to come in to see me as often. Maybe people are doing this a little bit longer. I think this is a great way to just look a little bit better, especially for the holiday season. You want to look a little bit better without people knowing. This is awesome.
Yes, Mike.
But here's the thing. What's inside that little box that you have? Is there a syringe?
Yeah, it's a shot. It's an injection. Yeah, so we're not going to do that on camera.
No,
because
but that's how you get it in there.
Exactly. Similar to, look, women, men, they're doing all kinds of injections. It's a modern way to look a little bit better. But yes, you're going to be fine. And by fine, I mean, I think you're going to be looking extra fine when I see it in an hour. So Dr. Bloom's going to do this. So take a look at her, see how gorgeous she is now, and see if you can tell if she's any more gorgeous. Literally in an hour, you're going to see the difference.
Okay, he's going to inject right now. Okay. 7:52. Anyway, here's Jen, though. We get to see her.
Hey, guys. Okay, here's the thing. Voluma, I think that's how you say it?
Yeah, exactly.
The injection. It has happened. And guess what? Our patient, she's headed back here. Mike, Karen, you're going to freak out when you see just how much has changed in less than an hour.
It's 8:46. Okay, last hour we met a woman who was about to get a needle shoved into her face on purpose to fill in her cheekbones and make them look more youthful.
All right, so we don't show the needles on television, but Jen's going to show us the results, and already she's teasing us. Pretty amazing.
Hey, Jen.
Mike, do you have to put it like that?
Seriously.
Well,
It's just, this is what people are doing. They're getting injections with Dr. Jason Bloom. Good morning.
Good morning.
Should we show them? Okay, look at the before. Look at the before of Ange. And again, this is a beautiful, gorgeous woman.
Absolutely.
Okay, ready to show your work?
Ready.
All right, look at the after. Yay! Okay, so first of all, Jared, our photographer, came in and watched you do this, Doc. And he was surprised. He said he saw it like instantaneously. And again, it's a subtle change, but there's something there.
Exactly. I actually showed Jared the halftime, as I like to call it. I did one side of the face, and actually you can truly see a difference from one side to the other, and he was kind of blown away. And then we obviously did the other side, but you know, all we did was make two little pokes. You can see maybe here and here. That's the two areas that we went in, so only two pokes with a little needle, and we're able to do this without, she's going to have like no bruising. She looks great. She can go right back to work now, no downtime.
Okay, so someone could come in and do this literally in less than an hour. You put some numbing stuff on her cheeks.
Exactly, yep.
Okay.
Yeah.
It doesn't hurt? You're not in pain right now? No. We talked about it. You said it really, like, you like this product because it like lifts the cheeks, right?
Because of this technology that they used, it's very highly cross-linked, as they call it. They use this via cross technology, which allows you to lift. It gives you a lot of lifting capabilities, and because of this cross-linking, it actually gives it the longevity, the 2-year lifespan.
And that's what people, they like that it can lift, and they also like that it allows, so she doesn't have to come in every 3 months, every 6 months, not even every year, 2 years.
Exactly, it's great.
A lot of people are asking on my Facebook, and is there anyone that isn't a candidate for this?
You know, I like to say, you can't really inject your way out of a lifting situation. So when you need surgery, or you know, depends on a lot, if there's a lot of volume loss and things like that, we have other things on the market. Surgery is an option. There are many different kinds of things, but this is a great way to kind of stay away from the knife and kind of just get a little bit of rejuvenation for the holidays.
And again, you said you could do it, like we've seen it. She literally did it in an hour. And then in terms, we know it's a longer term procedure. It's like Botox is in the hundreds of dollars.
Right.
Something like this, a little bit more.
Yeah, you're looking at, on average right now, it's going for about $1,000 a syringe.
Okay.
On average, most people do maybe one per side.
Okay.
So you're looking about 2 mLs, which is about $2,000.
But again, you've said it, and I'm guilty. You go and get your, not that I'm trying to do a big commercial for you guys, but a lot of women, we go and we get our facials, we get our this, we get our that, and you think about all those things that add up. What is the number one thing you like about this the most? Why are the doctors talking about it?
Well, I think the doctors are talking about it because it's new and exciting. The reason why I like it is the longevity and the lift. And the FDA kind of has cleared this for an area that no filler has ever been cleared for before.
Because before you were doing it in the lips, you were doing it in this area.
Right.
So this is so it's like coming up the face a little bit.
Exactly. I think fillers in general have gone from just line filling, or filling in a line, to now we can do things like lifting and kind of volumizing the face, giving it some structure, a little bit of sculpting. I think that's the future.
Yeah, you look great.
Jen?
Congratulations. All right, so we're just beginning here. We're going to do something called E-Matrix in the 9 o'clock hour. Again, little things that could, you know, you look outside, it's terrible and yucky, you can make your face look lovely. Mike,
Jen,
and Karen, what do you think?
I think it looks great. Here's what I'm curious about. Can you use it, ask the doc, the lines that you get around your lip?
The lines you get
And
around
I have a
the
friend,
lips?
not that I have.
Would you... Be quiet, Karen. The lines that you have around the lips, can you use that to fill in there?
Not this product,
Okay.
but there's a number of different things that you can do for that.
Okay, good, great. Like people who smoke and stuff get that.
Right, the lipstick bleed lines, things like that.
Oh,
Don't look at I hate coming here.
Right now, it's like,
I'm always like, what can you do for this? What can you do for that? What can you do for this and this and that?
Okay,
Thank you, Jen. That was great.
850.
Okay.